Okay, can everyone hear me okay? Yep. So thank you all for coming and staying. I think the topics have changed quite a bit. I think we've been talking about restless legs, and we're moving now into another problem of sleep, which is obstructive sleep apnea in general, because what I'm going to be talking about is what can a dentist do. And in most of the things, yes, if you have restless legs, please don't come to me. I think it wasn't me. Oh no, it was over there. Okay, so please don't come to me or to any of my colleagues, because we will have no clue of how to do. And I think by now you're all better doctors on that than most of the dentists that are out there. Okay, so not that issue. In terms of sleep apnea, I think just because of our times and how many of us are lecturing outside, I'm going to kind of coming before Dr. Fleetham, who's coming right after me. He's going to talk how we diagnose, who has the problem, and I'm already jumping into treatment. So just bear that with in mind that I'm talking about how to treat, and you may not even know really what the disease truly is, and I won't spend too much time on that rather than on the treatment. So at least we can do a bit, but if you have questions, of course, I'm happy to address those, but we'll mostly be talking about the treatment per se. So what we're mainly looking at is snoring. Okay, it's a fun thing. It's in every cartoon. It's everywhere. Snoring has been taught to be a very important thing that man had so they can keep the bears out of the cave. Right? You have to scare the bears. You have to make sure your family is nice and safe. But guess what? Everyone is just disturbed about it. You can't sleep with it. And actually, people found out that the bed partners of snorers sometimes develop high blood pressure. Just so much noise was there, and being worried about and being waken up by that, and so on and so forth. So not an easy thing to be the partner of the snorers. But as most of my patients who snores come and talk to me, I never heard myself. I have no problem. So it's normally the bed partner issue. Well, it's not just that though, because the main thing of snoring is that that's one of the main signs of obstructive sleep apnea. Okay, long big word. I'll try just to quickly explain what that is and why do we have the snoring. As a simple way of thinking is it's a lot of air going in to your lungs and out. Right? But let's say now I have this balloon that has to come from here into my lungs, and that air will have to go out to the balloon. But now a little bit of my airway here gets smaller. So the little tube that I breathe is tiny, it's narrow. Instead of being that big, large tube, now it is the size of a straw. Can you imagine sucking to a straw? The first thing you do is you increase the effort, right? And the second thing, by the noise I'm making, you can tell the air is going fast because it has to funnel in and cross that straw pretty quick. That's the same thing as when we are walking downtown here and suddenly you get the wind coming and tons of buildings. What happens with the wind comes and funnels in and it increases the speed. And once you have the trees, the streets start shaking, the flag starts making noise, and you know, the skirts of all the women go up. This is a little bit of a turbulence of the air is going all over. And what is that turbulence? And here, it's your snoring, which means your airway is small as a little straw or even less. Okay? And at that point, it's so narrow that how many of you haven't tried some time to get that thick milkshake and suddenly your straw collapse, and the more you suck on it, the more it collapses. You have to let it go a little bit and just start slowly again. So the same thing is happening to your breathing. Okay, so that's the same mechanism with a little bit of a narrow airway. How does it get narrow? We have many possible things, and I won't go into much of those. The most common that people talk about is obesity, right? As I always say, on the outside we get bigger this way, on the inside things get smaller. You may not be recognizing my accent. You may have found my name is slightly off. I'm a proud Canadian for 20 years, but I'm originally from Brazil. And guess what? In Brazil, we love to eat tongue. And you know why? Because it's full of fat. And yes, what we found out is that patients with sleep apnea get fat tongues. And if we compare a patient that is the same weight of a patient who has sleep apnea and one that doesn't. The one that has sleep apnea, and we do those MRIs of the tongue, those guys who develop sleep apnea have more fat on the tongue. So the airway gets even smaller. Not always you can tell just by the size, but the composition. And you can think of, like our arms when it gets full of fat and how it doesn't function as well. The muscles don't respond as well, and if there's fat in it. So there's a progressive thing. So the function gets disturbed. And of course, and it gets your airway smaller, and it's easier to collapse. It's easier to have that snoring. So what do we have in terms of treatments? I'm pretty sure many of you heard about CPAP. Okay, CPAP is a mask that will push compressed air into your airway, and by just not oxygen, just air, and with that it is going to keep your airway open. But yes, I could put those pictures in, but I don't think it is a sexy treatment, is it? It's an amazing treatment. I'll have to say I refer many of patients who come to me and said, I don't want that, but it is an amazing treatment, and Dr. Pleaton is going to talk to you about that. But what about that treatment? We know it isn't sexy, and it actually can be scary. Patients don't know how to use. Suddenly you have this pump blowing things into you, and you have air coming out of your hair, and when you turn to your partner, it goes air into the partner, and on and on and on. So it can be scary. It's not an easy thing, and that's a common thing that we see. Patients don't know how to use, so they have overmarks. I have to go with all of this in this tube, and I'm going to strangle myself with it. Yes, it can be scary, but it can be amazing. And I'll just say, keep an open eye for it, because in some cases, yes. But it's not for every patient. It's not everyone who can get used to the CPAP. And especially more for the milder cases. It is almost too big of a treatment for the milder cases, for the snorers or patients with mild sleep apnea. So are there options? And most of the times when we go and we talk to a physician, they said, of course there are options. And they show you all the different masks. But they all still connected to a tube, connected to a machine. So are they truly options? Or are they just more of the same? Okay, because you're still talking about CPAP. Yes, they can help you adapt and things, but what are the true options there? So when we talk about that, is an area that comes really to me, because we believe patients need choices. We make choices in life. We make choices in terms of how we eat, how we do things, how we take care of ourselves. If you're having diabetes, you go for a different diet. Sometimes you want for different drugs. And sometimes, depending on the day, you would go for a different treatment on a daily basis. But so there are a lot of things that we looked at when we believe that patients could choose. And we're thinking, what could those be? Could be how severe you are, how big of a problem do you have? Could it be because how big you are in terms of weight? Yes, there are some treatments that are better for patients who are heavier than they're not. And there are a lot of other things. So we here in BC, we know a lot of us love going out and camping. Can you hoist this machine? Big cable, where I'm gonna plug in? Oh, no, but you can take a battery. Okay, now I'm going camping with a big battery and a CPAP on my back. It gets harder. So you have to understand the patient. But until very little ago, all we could say is the CPAP. Doesn't matter what, it will be the CPAP. The truth is, again, if all you know and all you have is a hammer, everything's gonna be looking like a nail. So good news, we do have options. What I'd like to show, this is a nice graph, and all of you can find it on the web. It is coming from CADTH, so C-A-D-T-H. It's called the Canadian Agency for Drugs and Technologies in Health. So this is from the federal government, so they are kind of linked to the government, but arm's length, so they can do an analysis of what are the treatments that are there, that are good, that are cost effective in a way. If I give this to patients, I'm gonna save money because the patients won't get hospitalized and will work better, we have increased work productivity and things like that. So they looked with a little bit of a unbiased, because of course we all here, and you're probably gonna listen to a lot of sleep doctors or sleep dentists, as we say, we're gonna say this is the most important thing. but is it? How important is sleep? So they kind of take this different approach. They are just general doctors and they're looking at it. So what they have found is actually that CPAP and oral appliance are definitely indicated for those patients. And what I like to point out is that there are a couple of things that you have to think about it. So if you have the chance to choose, what would you take in time with you to help you choosing? Because we believe that who has to choose is the patient. Because who has to put that mask on the face or the appliance in the mouth every single night and use it for all night long is not your doctor, it's you. So you have to know, what can I stand? What do I feel like I can use for all night long? So I think that's important. Important to know, of course, coverage. It's still, both of the treatments are costly. Here in BC, we still have no coverage, from public coverage for both. A lot of extended health would cover both, but we still have that as an issue. So you need to understand that. In terms of having clean water, it's because the CPAP, you need to have distilled water to put in your CPAP in general. So depending on where you are, you cannot just drag that bottle of distilled water and so on. And sometimes you can think the appliance, you need to have a little rinse or wash, but that normally so little that couldn't be any bottled water, so not a problem. But the main point that I'd like to point here is patient preference. We have to listen to the patients, because who needs to like it or dislike it? It's not me as your clinician, but it is the patient. Okay? Of course, there are some side effects, and I'm going to show you guys some side effects so it will help you understand. Of course, you have to have an access to a dentist. And I'll talk as well, how to choose a dentist to help you with that. And yes, by having teeth or no teeth will impact as well. There are different appliances for patients who do not have teeth versus the ones who have teeth. But again, that may influence either sometimes the dentist that you're going, some have more experience, and the ones who do not have so much experience may not know how to deal with the patients without teeth. So what are these mandibular advancement devices that I'm talking? What is this other option that is now available? It is recognized by the government as a good alternative, an effective alternative. So it could look at anything like this, all these appliances. And what do they do? How many of you have taken courses like first aid courses, right? Many of us, Canadians, do that a lot, because we many times are willing even to help anyone on the streets. And the first thing we do, bring the jaw forward. It's a jaw thrust maneuver, isn't it? That's all we're doing. But we, instead of just having someone to keep holding your jaw all night, we put, as we say, a lot of little acrylics or something in your mouth that will keep your bottom jaw forward during sleep. Okay, so that's pretty much it. And we know by the anatomy, by pushing the bottom teeth forward, the tongue comes with it, right? We open the airway. Isn't that what we do in first aid? Same thing here. But we don't need to put that much forward, because when we put that much forward, it hurts, okay? We normally do that with unconscious patients, and we just get that off. But here we do gentle, and that's why all of this have kind of mechanics to it. They have something that it is adjustable. You can change pieces. There are some that look like screws, because we have to move that jaw forward very slowly. Otherwise, yes, we can still cause problems. But yeah, by moving the jaw forward and stabilizing that position, we can help, and help a lot of patients. So, is it a good option for you, or for your partner, or for your parents, or for any friends that you have? So it is definitely the ideal alternative therapy for people who have been diagnosed, especially with mild to moderate, who prefer this type of treatment. But if you do have yet severe sleep apnea, I would really, really say try the CPAP as much as you can, because that would probably be better if you can use it every night, all night long. So it's not just use it. Pay attention, I just said use it every night, all night long. Okay, which that's hard, because many people who have the mask on will always say, I don't know when, but I just took it off. I took it off during my sleep, and I woke up, it was on the other side of the bedroom. So we have to understand, and the good thing is that the CPAP machines can tell you, what time did you do that? Okay, and that's what we've seen, that the majority of, not the majority, but a big number of patients will end up doing it. So the patients, the number of people who can actually use these appliances for enough hours to make their sleep better is about 50%. So half of the patients who have the problem and are prescribed the CPAP will not be able to use. And then is the time to come to us. Is that the time to go to your dentist? Okay? So if you cannot tolerate, even if you're severe, that would be definitely a question. So what do we know? Will it work? So we have about 90 to 90% of the people who use an appliance say the sleep is better and the snoring is reduced. Not eliminated, but it is reduced in about 70%. So to the type that most of the partners can sleep through it. The other thing is about 50 to 70% in terms of those apneas and hypopnea. So how many times is that airway closing? About 50 to 70% of those of the patients will have those back into normal levels. Not everyone. So you see now what I'm talking about, the CPAP. CPAP is better on that. But CPAP works for about 90% of the patients, but only 50% can use it. The appliance is the other thing. We have 90 to 95% can use it, but it will work only in about 50%. So it's better, it's a matter of finding the patient the right treatment. Okay? So it's not the one thing for everyone. You have to understand what it is. And in terms of an ideal clear cut, just for one of the things we talk about, for oral appliances or mandibular advancement splints, the ideal you have to have at least 8 teeth in each top and bottom. And then as well having a body mass index, which is kilograms divided by square meters of less than 35. So not being heavily obese. Okay? Can I try one? Because CPAP, if you go to many of the companies that are out there, they will lend you a machine. Sometimes they will just ask you to buy a mask or something like that. There are quite a few of those. So if you go to Shoppers, London Drugs, or any drugstore, they, you know, if you go to the shelf that goes for snoring things, oh, there's all sorts of things, isn't it? And I come with patients that come with a bag full of those. I've tried all of these. Okay, will they work? They do, and sometimes, and these are what we call the boil and bite. You know, a lot of people who do sports have some of Mouthguards like that. You just buy the little thing, you put it in a hot pot, and then you put it in your mouth, you squeeze that in. If you don't burn yourself, that's great. And it molds your teeth and it stays. So similar dose, but they look fine. The other thing is that you all know how anything in your mouth you feel is big. We can identify a hair in your mouth. So anything that is a little bit larger than your teeth, it's uncomfortable. These guys are pretty much one size fits all. So if I have to go to any of those, I have a little mouth. You know, it's big in my mouth, so it's uncomfortable. So there are many studies, and they have looked at it, and the majority of the patients find it bulky, really different, and they compare this to a regular appliance, like those ones that are made to fit the patients. They have a lot of side effects because they're so big, patients start drooling. And because you're putting on yourself, many times it press some more teeth than others. And really when we looked at the efficacy, do they work? It's only about 1/3 of the patients who could get a regular appliance to work. Only 1/3 of those can actually get the success with this. So it's almost, we are putting about 2/3 of our patients in disbelief of this therapy, which it could still be a hope of a treatment for you. So we tend not to use it too often. So this is, I'd like to point out in terms of a little bit more statistics and numbers. So here is just to show you on the table, we call it success or partial success is in terms of are we really decreasing those apneas and the times that you stop breathing. And you can see the more severe you get, the less the efficacy there's gonna be. Okay, so yes, that's again why I said in the beginning, if you're severe, please, please, please start the CPAP first. It's likely much better for you. Okay, so that would be there. We know patients with less than 60 have higher chances, so it will be more than those numbers. And again, less severe patients, or patients who the oxygen doesn't drop so much, okay? Because when you have an apnea, your oxygen is gonna fall as well. So what do patients feel? And that's the important things. And we asked that in some research. And when they looked at it, and patients who have tried both treatments, they say, you know, I really feel that the mandibular advancement splint was the best treatment. So that was about 20%. Then I have another almost 40% who said, no, the CPAP feel much better. And guess what? It's about 50% say they work exactly the same, despite what the studies say. So if I take the patients to a sleep laboratory and I look at the results, the appliance is still not as good as the CPAP, but the patients many times feels the same. And what we need is for patients to feel better. So symptoms, tons of numbers. This is what researchers like. Let me do a little bit of a summary. So what we look at is in terms of symptoms, and one of the main things we have many times is sleepiness. So patients would feel the same, as improved in their sleepiness when they use mandibular advancement splints as when they use the CPAP. In terms of quality of life, the same. They feel great improvements with both. And even the driving performance, and that's for us is something we worry about, and there's going to be someone talking about this later today, which is actually when you get sleepy, you're more prone to having car accidents. But there are some little tests that we can do, and it was the same. So what if we talk about blood pressure? And the same thing. And overall, there was not much of a blood pressure change, but we know for hypertensive patients, especially with patients that are more than one, the 2 drugs to 3 drugs, they have that hypertension that won't go down. And if you put a treatment, it will be a little bit of an improvement with both. And it's equal the improvement between the two. How come? That's what I'd like you to drive you to the graph on your left. That's what we call the mean disease alleviation. Okay? Sorry for the name, but what does it mean? It means that it's not how well it works, but also how often you use. Because it can be an amazing treatment, but if I put it on for 10 minutes and take it out, it will make nothing to me. So we have to put together how well it works, also by how long do you use. And that's what we're trying to understand nowadays. Both aspects are important for this type of treatment. So, patient's preference and choices. I think that's important. We know Starbucks, and that's, we are in academia. We have nothing more to do than calculating how many drink combinations we can get out of Starbucks. And that's 87,000 types of combinations. And why do we have Starbucks in every corner? Because every one of you can choose the drink exactly the way you like. And we feel now that medicine has to go the same way. We have to understand, what do you prefer? What does it work better for each of you? So I talked a lot about the 2 options, but does it have to be a separate thing? Can I put 2, 3 things together? We know in diabetes we do that. You improve a little bit your diet, you do this a little bit, and yeah, one day I want to have that cake, it's such an amazing cake, I miss it, and you just go and you have insulin. So you could mix and match a couple of things. We know, for example, positional therapy, which is a very easy thing. A lot of us do. Your partner is snoring, elbow, turn to the side, we all can sleep, right? So that's an easy thing. And there are ways that we can do to make patients sleeping on the sides. Exercising is a great thing. So you have to exercise quite a bit. It's about 50 minutes on a treadmill 4 days a week, and that can help a lot of the apneas. Alcohol, try to decrease the alcohol before bedtime. Alcohol will just make your sleep worse, and if you have sleep apnea, even worse. As I always say, a little bit of alcohol, not a problem, up to 2 doses 4 hours before bedtime. But we know that if you drink a lot, your tongue gets like that, right? Your tongue gets soft, and it will fall back on your airway, will make things worse. So can we mix and match the appliance and the CPAP? So this is a study, and don't worry much about the graph. This is just for you to see what we've been doing, is if you give both to the patients, what would they use? And what we find here in this pizza on your right side is, there was about 15% of the patients say, really, I hate that CPAP, I cannot use it. And there was another 20% that no, I hate that oral appliance, I don't like it. But half of the patients said, you know what, some days I use this, sometimes I use that because sometimes the appliance hurts, sometimes the CPAP hurts, and I can go back and forth, and that gives me higher flexibility. So that's something that we're looking forward to. So that's where we are in medicine. We are calling now the P4. We're trying to predict for whom is it going to work. We're trying to prevent the disease if we can, but then we need you to participate in the treatment, and we need to personalize it. Okay, so we're getting into a little bit more than what just us believe is best for you. And this is what we say in our field. So patient preference is important. Decision aids, which is giving some little tools to help you adjust that. And the most important is you have to have the multidisciplinary teams, or teams that involve the physicians, the dentists, the nurses, the physiotherapists, and the ear, nose, and throat doctors. Everyone needs to be with you. So is there the perfect treatment? No, it is not. There are some side effects of oral appliances, and yes, in the beginning you can drool a little bit, you can feel weird, your gums may hurt a bit, and in the long term there's going to be a little bit of changes on your bite. They are small, so this is a case that's showing after 10 years, and I put those little dots just for you to follow the teeth, and that's how the teeth are moving. So bottom teeth are gently moving forward, and top teeth gently moving back. The majority of the patients don't even notice. Okay, you need to know that does happen, but it is so slow that you will always develop new ways of chewing. But you need to be aware. So if you love your perfect smile, that may not be the perfect treatment for you, but in general, patients don't even feel the changes that are there. But it's important for you to know. So, going back to my question, can my dentist do it? I think it is still a fairly new field. We just had a day and a half only for dentists talking about this. And we are getting more and more dentists trying to help. We've been trying to do a lot. I've been teaching a lot, doing a lot of research. We have a big group of research at UBC together with the physicians at UBC. But it's still fairly new. So there are standards and guidelines with our college. So if you need to understand what is there, we have that. You just Google within our college and sleep apnea. But the important thing is find a dentist who's used to work with that, okay? Finally, I'd like to say, can we identify it just with imaging? Some of the dentists may say, oh, let's take some x-rays and things. I'll look in your mouth. We cannot. We always need to have a diagnosis. And that's what Dr. Fleetham is going to talk in just a little bit. So my final comments would be, it's not as good as the CPAP, okay? But it is definitely an option treatment for all levels of sleep apnea. And I think we believe that treatment planning together with you patients, so that you can come together and decide what is better for you, is actually what's going to achieve the best quality of life and life expectancies. And yes, specific dentists can help you doing that. Okay. Thank you. Questions? Yes.
Thank you.